Hi all, welcome back to my channel Adira's tutorial. Today we are going to discuss a small topic from Child Health Nursing, that is congenital heart disease. Under that we are going to see ventricular septal defect. So coming to the definition of ventricular septal defect. Ventricular septal defect, in this condition we can see there will be a defect or hole in the lower chambers of the heart. Especially we can see there will be a defect in the ventricles of the heart. That is called as ventricular septal defect. And it is one of the most common congenital heart disease and which is coming under cyanotic heart disease. Then coming to the incidence of VSD, it is equally, we can see this condition will be equally distributed in male and female child, and this is one of the most, as I said before, this is one of the most important cyanotic heart disease. When discussing regarding the types of ventricular septal defect, there are mainly two types of ventricular septal defect. First one is muscular VSD and the second one is membranous VSD. First we can see the muscular VSD. In muscular VSD, there will be one defect. There is a presence of defect in the lower part of the ventricles. That is called as muscular VSD. And in membranous VSD, the defect will be present in the upper part of the ventricles. That are the two types of VSD. That is membranous VSD and muscular VSD. Next we can see the clinical manifestations of ventricular septal defect. Coming to the clinical manifestation, the first and foremost thing we can observe, that is right ventricular hypertrophy. This is one of the cyanotic heart disease, and here the blood flow will be from left to right ventricle. So there is a shunting of blood flow between left ventricle to the right ventricle. As a result, it is causing right ventricular hypertrophy or the enlargement of the right ventricles. And the second clinical manifestation of VSD is pulmonary hypertension. Why pulmonary hypertension is happening in this case of VSD means because there will be increased blood flow to the right ventricles. As a result, there will be a build-up of pressure in the right ventricle. So, and there will be more amount of blood will be moving into the lungs. So that is the reason the patient will be developing pulmonary hypertension in case of VSD. Third one is heart failure, and the fourth one is clubbing as well as cyanosis. And the next clinical feature is loud pulmonic ST. And coming to the last clinical feature, that is Eisenmenger syndrome. Eisenmenger syndrome, why it is happening means there will be increased blood pressure which will be built up in the lungs. As a result, I said that there will be one more problem, that is pulmonary hypertension we can observe in the lungs. As a result, this Eisenmenger syndrome will be occurring. Okay, these are the clinical manifestations of VSD. Next we can see the diagnostic evaluation of VSD. The first diagnostic evaluation we can do to rule out VSD is echocardiogram. And the second one is radiography. Radiography will be helping to assess the degree of cardiomegaly. And the third one is ECG or electrocardiogram. Electrocardiogram, in case of large ventricular septal defect, it will be showing that in the result, in the interpretation, we can see that there will be biventricular hypertrophy. So these are the findings we will be getting while doing this investigations for this VSD. Once again, I will say diagnostic evaluations are ECG, radiogram and echocardiogram. We can see the management of VSD. Coming to the management, if the child is responsive to the medical management, we can wait for around 12 to 18 months for doing surgeries. Or else, if the child is not at all responsive for the medical treatment, as soon as possible the child has to undergo surgery. Here the recommended surgery for this VSD is pulmonary artery banding. And pulmonary artery banding is mainly we are recommending in the case if there is large defect or multiple defect. In that case, the child can undergo pulmonary artery banding. At the same time, we can do one more surgery, that is amplastar occlular surgery. These are the two major management we can do in the case of VSD. I hope you understand the topic. If you have any doubt, please mention in the comment box. Please like, subscribe and press the bell icon for getting notification. Thank you.